Hi, I'm Tom Lewis, founder of RealHealth Innovations, a health creation company. I'm a medical scientist with degrees from MIT and credentials from the Harvard School of Public Health. RealHealth Innovations is all about helping individuals prevent or overcome the most severe diseases in our society, chronic diseases. So what are you suffering from? What's going on in the medical world today is we really focus on conditions once you already have severe pain or severe debilitation. But what RealHealth Innovations is all about, and we're particularly good at, is identifying conditions long before you have a diagnosis. So for example, if you've gone to your doctor with complaints and they're really not sure what's going on, we probably have a solution for you. Anything from stomach problems to you've done everything to lose weight and you just can't get over that hump, or you gain it right back. Well, there's something going on else in your body that's like a boat anchor dragging you down. Fatigue is a major issue that we have in society today. Sleeplessness, stress, or you just don't feel good. I'd like to tell you a little bit about what we believe the underlying cause of that and what we can do about it. So there's a lot of folks talking about inflammation and all the diseases attributable to it, from cardiovascular disease, obesity, asthma. In fact, Time magazine talked about inflammation as being the underlying cause of so many diseases almost 15 years ago, but still no one's doing anything about it. What we do is we measure for inflammation and then help you reduce your inflammatory burden. And what we find in our folks is all these conditions, from metabolic syndrome, type 2 diabetes, to even gingivitis, go away. So let me explain the process that we use in our investigation. So if you look at these glasses, these are 5 different individuals, and they all feel pretty healthy today. Yeah, this person, look upon these as the representation of the person's inflammatory burden in their body. This person's managing their inflammation, but just barely, whereas this person has a huge reservoir and can handle the inflammation. Think about someone who's stressed out. Some people fly off the handle very easily, and some people can handle the most stressful situations without ruffling a feather. So we're really measuring where you are on this spectrum. We call it how full is your vessel. And this is really a measure of where you are on the health disease continuum. What we're really worried about is, are you spilling over? This is now you have symptoms. What is your pain? Is it pain in your joints? Is it type 2 diabetes? But the place to take action is when your cup is hardly full at all. You have to be your own doctor to some degree, and this is what I mean by this is the following. So when you have great health, yes, our health will oscillate throughout the day. We'll get more tired, we'll get more rest, we'll feel better, but you don't really have symptoms spilling over. Whereas a person on this end of the continuum, in the lousy end, feel lousy end, has constant symptoms and poor health. But somewhere in the middle, every once in a while you'll have a little spillover. Don't look at those as just a one-time event. If you didn't have those symptoms at one point and now they're spilling over a little bit, you're heading in the wrong direction and you're going to wind up here. This is when the medical system takes over your care, but this is when you and our organization, RealHealth, should be involved in your health. So classic examples is GERD. Just a little acid reflux once in a while. Not acceptable. You should never have acid reflux. Bleeding gums. When you floss your teeth, if they bleed, you slough it off. You say, it just bleeds a little bit when I floss, but at one point in your life, I'm sure it didn't bleed. You're heading in the wrong direction. Next slide. So really, what you want to work on is going down this continuum from poor health to great health and not being satisfied with just average health, because as you get older and your immune system gets weaker, it will catch up to you. Next slide. So medicine, once you're sick and you have symptoms, they're very good at answering the question, what? You have type 2 diabetes, take this treatment. But there's something underlying all these conditions. So it's not the what. You should be asking your healthcare provider at all times, find out why. Answers, this is how you'll get answers to those unanswered questions about why you don't feel well. My name is Dr. Tom Lewis, founder of RealHealth Innovations. We're chronic disease specialists, and we're here to help you prevent or reverse the chronic conditions that are affecting the quality of your life. Thanks very much.